So let's go through some of the common injuries that occur in the lower back. I feel that we hear about these daily. So what are those?
So a bulging or herniated disc, we talked about that when I showed the pictorial earlier. That's very common. People have bulging discs very commonly as those outer bands start to weaken, the disc bulges backwards, but it doesn't necessarily have to touch the nerve. When it comes out as a disc herniation, then it might pinch the nerve and you get the leg pain when we're talking about the low back. Another common condition, more seen in elderly patients as we get older, is spinal stenosis. As the earlier picture noted, that you can have narrowing of the canal, and we saw that video earlier very graphically showing that. And when you get narrowing of the canal, either it could be congenital, so that's the hereditary predisposition, or it could be acquired due to the arthritis. Will start to close in on the canal and make it narrower in the center. And so that will give you heaviness in the legs, fatigue in the legs, numbness and tingling. Difficulty walking. Most patients will tell me that I can only walk a block or two, and then I have to sit down for 5 minutes, and then I can start walking again.
Right.
And there's something called the shopping cart sign. So when they go to the supermarket,
You're
they lean on the cart.
carts.
That opens the canal just a little bit, and their symptoms go away for that little bit of time that they're doing that. The minute they stop pushing the shopping cart, they can't walk very far again.
We also talked about something called vertebral fractures as well, and spinal tumors.
Right. So I mentioned earlier the main area for metastasis is in the mid-back, the thoracic spine, but it can also occur in the lumbar spine as well. For example, when a patient comes to me with a history of prostate cancer, I want to make sure they're not getting metastatic disease into the lower back, because it can occur there as well. So as we talked about earlier, if someone's not getting better, we have to dig deeper for some of these other things. It's not the common thing, but it can certainly occur, and you don't want to miss that.
Right.
And then osteomyelitis is an infection that can occur. We see it sometimes with people that have had procedures where there's been a lot of bleeding in the procedure, and bacteria can get in there and go to the spine and create an abscess or a pocket of inflammation and infection. And that's very dangerous. It needs to be treated very aggressively.
How would you treat that?
Well, you treat it with IV intravenous antibiotics, and you might need surgery to decompress it and wash it out as well. It's a very serious condition that could be life-threatening.